So the biopsychosocial model is pretty cool. I really enjoy it. Some people extend further and use a biopsychosocial spiritual model, but we do know that a lot of the literature says that we're really good at figuring out where to meet our clients when we're looking at the checklist of distress and the areas of needed improvement. So distress and needed improvement in these main categories that basically overlap. So we're talking about the biopsychosocial model. Bio is biological, as you can guess. Psycho is the psychological, and then the social aspect, all put together for the biopsychosocial model. So biologically, we're listening and looking for health complaints, poor sleep, fatigue, distress, hypervigilance. We're looking and listening for changes in abilities and movement, hobbies, about how they can be supportive, and then also things that they can do to manage their own internal distress. Things that family members can do to manage their own anxiety because they are concerned about their family member of color. And so that was one of the questions. Then I also have another question about a case example and how individuals and clients are dealing with the things that we see on the news as it relates to shootings of individuals. Uh, Other questions about protests as it relates to Black Lives Matter. And so we're going to revisit the case example, and I'll try my best to weave the answers into that as it relates to this presentation, because it seems as if, based on these excellent questions, that we could have spin-offs of how do so when looking at racial trauma and treatment, we are going to do a thorough assessment. And remember that we don't have to get it perfect for the first session. There may be a few sessions where we're steadily uncovering really important things for our client. Then we want to make sure the things that our clients are sharing are being put into the context of their worldview, not us as clinicians, because we know that our worldviews may differ. Our identities are different. What we find is important varies from day to day and moment to moment, but we're definitely putting it into context, and we're making sure that the treatment is appropriate, and we're making sure that the client is engaged and ready to move forward. So what do we do? Well, we have to think about, well, what do we know? We have to think about our areas of expertise as mental health professionals. Are we more, you know, cognitive behavioral? Are we along with relaxation skills and assertiveness training? If an individual is in an environment where they feel microaggressions are happening with language that is inappropriate or rules that are being made that they feel targeted, then assertive training about how they feel, how to type up an email, consult with HR, do things to let them feel as if they are having some control over their situation and that they have a voice. And also being aware that self-talk throughout the day or stressful situations is needed and very useful, because what we know about trauma treatment, again, is that we have to laser focus on where is a person triggered, where are these things happening, and we also have to work with our clients to see, well, is it even worth broaching? You know, if you're going into a place and we're going to see a person once and they do